This is your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio.
From the Asian Community Development Council, this is Family in Focus, Mondays at 12 noon on PHLV Radio.
Hi, everyone. Welcome back to our episode of Family in Focus. A big day for a lot of families out there across Southern Nevada because this is the first day of school. So I've been seeing all over social media, kids of all ages going back to school during still one of the challenging times for us health-wise. As you know, the COVID-19 pandemic is still here. Delta variant is surging, and a lot of parents, a lot of families, of course, have been asking a lot of questions, have a lot of concerns about sending back the kids to school. Of course, they're very excited as well, but we want to make sure that families stay safe and kids stay safe. So today, we're actually going to be talking on that topic. We have a health expert with us today. We have Ida Sorongon. She's a nurse practitioner, and she's also a medical provider at First Med Health and Wellness here in Las Vegas. And Ida, thank you so much for being here. I know you're having a busy, busy day, but thank you for taking the time to be here with us today.
No problem. I appreciate your invitation to have this like a conversation about the COVID.
That's right. Yeah. And I'm sure as a nurse practitioner at First Med, you are hearing a lot about this. First, talk to us about First Med Health and Wellness. You've been there for about 8 years, and you work with families, people of all ages, right?
Yes. So First Med is a federally qualified healthcare center.
Mm-hmm.
We have federal funds that comes from the government. So those funds help us in our mission, that is to provide affordable and quality healthcare, regardless of the ability to pay. So we offer both primary care, and then we have as well the behavioral side, which offers psychiatry and therapy services.
So all kinds of health services for people of all ages,
you see
right?
all patients, both pediatrics and adults.
Yeah, no, that's
we have
great.
3 locations and all over the valley.
Yeah, and I see the locations here. You have one on Eastern, Shadow Lane, Martin Luther King. So, and what's really great about First Med Health and Wellness too, Ida, is that you have people who speak different languages, right? And you speak Tagalog as well?
Yes, we have diversified staffing that can speak Spanish, Tagalog, and then we do have also translation services for all languages. We have Asian languages, we have Thai, we have the African languages, we have European languages.
That's great. And, just with, of course, Clark County, Southern Nevada being so diverse now, I think we need the services more than ever, right?
Yes. And when we do offer as well, accepts all patients, insurance, no insurance, Medicare, Medicaid.
That's great.
And yes.
Yeah, and Ida, back to school, I'm sure you have been seeing lots of families coming through. What are some of the, are they, especially with COVID-19 still going on, are they coming in and having questions just about health and safety for their kids?
Of course, we cater them, especially with this pandemic. We want parents to come to their annual check for the kids. So annual check is very helpful, especially this time of the pandemic, especially when they come to our clinic. We do check if they need to be vaccinated, and then we do annual check like screenings, like to check for anemia, check for PP screenings, like lead screenings, and then we need to check for their health and the nutrition status.
Yeah, so all kinds of things, of course, as parents are bringing kids back to school. And as you know, Ida, this is, back to school after being remote and being at home for the past year and a half for a lot of kids because of COVID-19. So have you been hearing some of the concerns with parents, especially with, the Delta variant and COVID-19 still out there?
Of course. We just need to educate the parents. We just need to educate the parents or the guardian. There's no other way, but it's to do communications to the kids. They have to communicate to the kids, constant communication, talk to them what is COVID and how to be safe and cope up with it. So I made an acronym like how to cope up with COVID,
Yeah.
like the COP. So first is like communicate with knowledge. Of course, you have to get information from reputable authorities like CDC,
Yeah.
WHO, your mandate from your local or county or state, or from reputable news network. That's just like fake news all over, like in the Facebook, there's a lot of
Right.
fake
It's
news.
important to get actual factual medical
Yes.
information.
So you
Yeah.
have to relate factual and you know uh, news to your kids,
Right.
and then you have to give them knowledge, which is they said knowledge is power. Kids feel empowered when they know what to do to keep themselves safe. You
Right.
know how to keep as well your family safe.
Yeah.
So like this time, the CDC guidelines for back to school includes you have to get vaccinated. You have to wear mask all time indoors. You have to do 3 feet social distancing now. Before 6 feet now, it's okay to have 3 feet social distancing. So according to their studies.
Yeah.
Then like respiratory etiquette, like cover when you cough or sneeze, hand washing, proper ventilation, and then of course re- staying home when the kid's sick and get tested. You have to do isolation and quarantine.
And how tough is it? I mean, from a medical perspective, obviously, when you talk to families, it's always hard with kids, right? I mean, for them to wear a mask and to be, washing their hands all the time. Do you have any tips for parents who may be having younger kids, of course, especially ones who can't be vaccinated yet, under 12, right?
That's
I mean,
why I said it's
yeah.
communication, and then communication with knowledge, and then another one is O. I'm trying to finish my
Yeah, so you have
acronym, the
C,
COAP,
communication.
COPE.
Yeah, what's O? What's O?
The O is openness. So when you communicate with your kids, encourage them, be open to them. You
Oh,
have
okay.
to uh, talk to them what they heard, how they feel. Let them ask questions and answer them appropriately. And then the third one is P, preparedness. So preparedness means provide their needs like your mask, your hand sanitizers, put them in their bags before they go to school. And then like make things a habit like wearing mask, hand washing at home. Take a bath arriving at home if you came outside.
Yeah.
And of course, laundry your soiled clothes from outside.
That's really good advice,
Then,
and I like how you made that COP, right? Something easy to remember.
I'm not done.
Oh, more. Okay, go ahead.
More. So
Okay.
P includes as well prevention. So prevention, visit
Oh,
to your doctors, get annual check, get your scheduled vaccines like your tetanus, your polio, your meningitis, your measles, and Hep A, Hep B. And of course, the most prevention is get vaccinated. We
okay.
really encourage to have the kids get vaccinated.
Yeah, over
And
12.
the next, the COPE and the E is exceptions. Exceptions, as you have to acknowledge the exceptions, which is like parents, we are also like scared, we are also anxious, but we need to stay calm for them so that you can support each other. It's like saying it's okay not to be okay. And
Right.
they'll tell the kids that I can update you later. We have to learn more later as days goes by. So how to cope up with COVID is to say COP, cope with COVID.
COPE, right?
Yes.
COPE, cope with COVID. So communications, openness,
Communication, openness,
preparedness,
and exceptions.
and exception. I really like that. And I think, you bring up a good point because when parents are anxious and concerned, I mean, the kids feel that, right? And they sense that.
Yes. You transmit it to them. So you should become as well as parents or the guardian. And then
Yeah.
assure them that even though it's not okay, it's okay not to be okay, but we can overcome it.
Yeah.
We can support each other.
I think that's really good because there's so much information, and you brought up the whole thing about, following factual medical information, because there's so much misinformation out there, right? At the same time. And kids are out there reading social media and parents as well. So do they come to you when you were as a medical provider and trying to hopefully try to get the right information to pass along to their family?
Yes. We always, part of annual checkup is also giving information and giving guidelines to the parents what they're gonna do to their kids.
Right. No, and that's great. And again, if you're just joining us live here on Family in Focus on this Monday, especially a lot of parents, some might be picking up their kids right now. A lot of kids are maybe half day at school, but we want to make sure we get this information. And if you watch this later, make sure you share it because this is great information that Ida Sorongon, she is the medical provider, also nurse practitioner at First Med Health and Wellness here in the Las Vegas area. They have 3 locations, Eastern, Shadow Lane, Martin Luther King. They offer primary and preventative care and behavioral health services as well. So they do a lot there. Ida has been there 8 years. You've seen a lot over the years. But when it comes to what's happening right now, Ida, with the Delta variant and COVID-19, this is really serious. And I think, when parents, think about kids, and we've seen this, I think the latest numbers across the country, tens and thousands of cases of kids who have contracted COVID. So kids can can get COVID-19.
Yes, they can contract COVID-19, but from World Health Organization, at this time, under age of 18, they represent only 8.5 reported cases. So for the kids, they usually mild diseases, although there are reported are critical. Usually those who are succumb with this COVID are with pre-existing medical conditions,
Right.
like asthma, heart disease, autoimmune diseases. But according to our Academy of Pediatrics in the US, children here represents only 13% of the COVID cases. So, and the research suggests as well that ages 10 to 14 are least likely to become infected with the virus. So parents should not be really anxious about it because for the kids, the infection rate is very low compared to the adults. And then they have mild symptoms compared to the adults.
So that's good news that it's not affecting kids as much, but we are seeing kids going to the hospital and, and testing positive for COVID. But you're still encouraging because you do offer COVID-19 vaccinations for kids over 12. And you're encouraging families to get kids vaccinated as well, right?
Yes, we have to teach the parents, the facts, like from CDC, like from WHO, that the COVID vaccine is still the effective tool to prevent transmission of the diseases.
Right.
People who are fully vaccinated are low risk of symptomatic or severe infection.
Yeah.
There's no other way. Still, vaccination is the leading public health prevention strategy to end this COVID-19 pandemic.
Yeah, and that's the message the Asian Community Development Council has been putting out there as well. And we actually have some fun pictures to share here, Ida. From this past weekend, as you know, ACDC has been holding vaccination clinics at Shanghai Plaza every Sunday. And take a look at what happened this past weekend. They're giving away free pack of Pokemon cards, right, for kids who are try to get kids out there. Obviously, they get Pikachu there, people getting dressed up. So this is a great way that they're trying to get people to come out, especially with back to school today. As many people vaccinated as possible. So that's great. So if people need to get vaccinated, First Med Health and Wellness are offering it. I think Ida was saying every Friday, right? That you do by appointment?
Yeah, we do every Friday COVID vaccinations for both kids and the adults. And then we tell them that, you don't need to worry because it is still a safe and effective way to prevent the COVID vaccines. Although there are cases that they said that there's heart problems, like the myocarditis and the pericarditis, but it's just only reported, but there are less cases
Very
compared
rare.
to the hundreds of millions of COVID vaccinated that reported.
And
So
we've
it's
had,
still mild and those are mild and resolves quickly.
Yeah. And with ACDC, we have seen families, people bringing in their kids to get vaccinated, especially going back to school. And you've seen more parents bringing their kids in because of back to school, correct?
Yes.
Yeah.
We as well last July we went to a mall as well, like Meadows Mall and then Boulevard Mall to offer vaccines, both the back to school, like the routine school vaccination and of course the COVID vaccine.
Yeah, and I think that's what's really important. I'm glad that First Med is doing that as well, just going to where the people are, right? Where the communities are to do that.
Yes.
Yeah, and are you reaching out to? And I know you're Filipina. Do you reach out to people in your in your group and your network to try to get the word out in different languages as
Yes,
well?
our one of our admin director, Miss Marie Crest, is
Mm.
reaching out the Asian community to do the COVID vaccines. We're actually before January, we were like all over the place already doing COVID vaccinations to other places aside from our own clinic.
Are you still getting some pushbacks? I know there's been so much information out there, but people who are still hesitant, they're like, well, I don't know. I want to wait a little bit longer. I mean, how do you deal with situations like that? I mean, what's kind of the best way? I mean, I know part of your tool is, education and communication. I'm sure you're doing that with your patients.
Yes, still education and communication. The parents try to really encourage them to get the kids for vaccination.
Mm.
Uh, and then, of course, at the same time, get themselves as well the regular vaccinations, even though at least, if they got, if they will not be got sick as well with the other, like your flu, if
Mm-hmm.
flu season, give flu vaccines, and the usual, your polio, your Tdap's, and the MMRs.
That's great. Yeah. So good. Some good advice out there. If you're watching right now, have any questions, feel free to jump in our link here at our Facebook page. I know ACDC has put up your picture and also some more information about you, just in case people have any questions. But I think some of the questions I've seen parents have out there is they're not sure what if their kids have COVID, right? Maybe they have a sniffle or a cold or something. What's your advice for what kind of signs to look out for, especially now that they're going back in school and being around other kids?
So COVID symptoms is just like similar to as well to adult experience.
Mm-hmm.
But the kids' symptoms tend to be mild and they're like cold-like symptoms.
Mm.
So they recover within 1 to 2 weeks. So the symptoms can be fever or chills, nasal congestion or runny nose, cough, sore throat,
Mm-hmm.
shortness of breath or difficulty breathing, fatigue, headache, muscles or body aches,
Mm.
nausea, vomiting, diarrhea, poor feeding or poor appetite, new loss of taste or smell, and stomach pain. So if your
Mm.
child has these symptoms, one or two, seek, go to your doctor, seek medical advice, and then get tested. Our testing areas all over the place here. We have all the pharmacies, they offer for free, and or your doctor's office.
So
And
my
then, as much as possible, keep your child at home.
yeah.
Then have your child use a separate bedroom or bathroom from family members.
That's my big question. Yeah, with the quarantine, because you say if you're tested positive, you should, be away from others for what, 14 days? Is that still the
Yes, it's still the 14 days recommendation for quarantine.
yeah, and it's something that just I know it's concerning for so many parents because they don't want their kids to get sick. They don't want to get sick, but it's out there, and this is what I mean, as much precautions we can take, right? I mean, that's kind of what you're telling your patients out there.
Yes, so there's no other way. Still, we have to follow CDC guidelines of the precautions.
Mm-hmm.
It's still wearing masks. It's still hand washing. It's still social distancing. And then, of course, now because we have vaccines, we have to get vaccinated. We need to get to that herd immunity so that we can lessen now the transmission of the disease.
Yeah.
It's all like more than 1 year already, and
Mm-hmm.
so hopefully everybody consider it not only for themselves but as well as like a social responsibility
Yeah, yeah. And that you bring up a
to
good
get
point.
vaccinated.
Yeah, it's not just you're protecting yourself, you're protecting people around you, right? People you love, your family, your
Yes.
friends. And I think people may not think about this that kids can get affected. A lot of kids are being, they're people getting younger, the one who are testing positive, right? And now that kids can get it as young as 12, I think that's the message that you want to get out there.
Yes.
Yeah, no. And any other advice? Anything you can think of that, as kids are going back to school, parents going back to work, what just, obviously with your COPE, right? COPE for people to think
Yeah,
about
so
that.
remember the COPE, COPE.
Yeah.
So get yourself knowledgeable about COVID. So you should know what are the guidelines now, and then do follow the guidelines, and then convey it to your kids. And then O is be open to your kids how they feel, and then P is be prepared or prevent, COVID. And then of course exceptions. Know that you will not know everything. Be open to the kids, but you can support each other.
That's great. No, and I know, a lot of people listening, you speak Tagalog, right? Is that your native language?
Actually, I came from down south. I have another language.
Oh, okay.
I'm Ilonggo.
Okay, perfect. Yeah. So people reach out to you?
That's why I have a little accent.
Oh, no. But that's great. Do people reach out to you and try to, speak in your language as well? Sometimes I feel like sometimes with cultural, sometimes they feel like they have a better trust for people who come from, are Filipino or Thai or Chinese, Vietnamese, when they hear from doctors or medical providers who look like them. Do you feel that makes a difference in your opinion?
Yes, we have a lot of patients who are Asians to Filipinos in the clinic. And then of course, it's the trust and how you treat the patients that make them coming back to your clinic.
Yeah, no, I think that's so important, especially as you're trying to convey this factual medical information out there, right? To make sure that people understand what's really happening.
Yes, knowledge is power. So the more knowledge you have, the more power. You're empowered. You empower yourself, you empowered others, and you know what to do and stay to be safe.
That's great. And I think that's a great way to wrap this up. Knowledge is power. Educate yourself and take care of each other, right? Your family, your friends. Ida, thank you so much for being with us here today on the show.
Of course, you're welcome. My pleasure.
Thank you, Ida. And if you want more information on First Med, you can find them online. Again, I think that I have a number, 702-731-0909. That is where you can go.
Please call us.
Yeah. Thank you. Yeah. You can ask for Ida, and she's there to help. And I know you still do telehealth as well. You don't even have to be at the clinic, right?
Yes, we do telehealth at the same time. And so if you have at convenient at your home, you can see us, and then at the same time in person.
Awesome. Thank you, Ida. Thank you so much for joining us. Also, a reminder, open enrollment is wrapping up soon for health coverage. So we have some information that we're going to put out for you here. Special enrollment period wrapping up August 15, just days away now. So make sure you reach out to ACDC. There are looking to help you. You see the phone number right there, 702-489-8866, or you can email healthcare@acdcnv.org. Make sure you get covered. This is the time to get your health insurance, especially as we're all trying to take care of each other and stay healthy. A great collaboration between Nevada HealthLink and ACDC. So again, thank you so much for watching today. Great to have you. Thank you to Ida for joining us on the show today.
I appreciate it.
Thank you, Ida. And take care of yourself and take care, everybody. We'll see you next week.
Take care, everybody, and be knowledgeable and stay safe.
Stay safe. All right. Thank you, Ida. Thank you, everyone. We'll see you next week.
Okay, bye.